Greetings, ladies and gentlemen, and welcome back on the business slash charity part of the Africa is Home Global podcast. Today with us we have our a special guest from he's originally from West Africa, but he's based now in Minnesota, Mr. Patrice. Thank you so much for coming on the show.
Thank you guys for having me.
Right, and also Mr. JP, thank you for always being our good presenter.
Absolutely,
Right,
absolutely.
thank you so much,
My
man.
pleasure.
All right. Today, Mr. Patrice is here with us with a mobile app that he created, and we're just gonna let him dive right into it and get us more details about this mobile app. So, Mr. Patrice, would you like to explain us a little more about your app and what it does?
All right, of course. So the name of the project is Doctaz.
Mm-hmm.
So this project was is actually by my uncle. He's the one who had the idea, full time Paulinus,
Okay.
and so me and a handful of very talented developers
Mm-hmm.
started working on the project. So the project actually is it's a telemedicine project for Africa,
Mm-hmm.
because as you all know, it's not telemedicine is not really present in Africa. And to be honest, if I we believe, based on our research and everything,
Mm-hmm.
if there's more of a sophisticated platform like a telemedicine platform in
Mm-hmm.
Africa, we believe that a lot of people who are ill with tiny little things that end up killing them,
Mm-hmm.
they can be actually helped, through telemedicine.
Mm-hmm.
So the project is called Doctaz. We call it, our tagline is connecting patients in Africa with doctors and nurses all over the world. And in order for us to accomplish our goals for this particular project, we built so many features that I'm going to try to get through all
Mm-hmm.
of them today.
Okay.
It's a pretty big project. We've been building this for 2 years now. So we're now ready to start uh, launching it in Central Africa first. All right, so now the first thing about the project, the first feature on the project is the e-hospital book. So now we all know back home in Cameroon, we have the strange system of recording hospital books. We people have to actually manually go with a little
So
book, a tiny little hospital book, and
Mm-hmm.
the doctor or the receptionist writes on there.
on
And
the
It's funny. I almost
paper,
forgot about that system.
I am
yeah,
a
you
medical
remember
profession, so yeah,
you remember
Absolutely.
that system?
Yeah,
uh-huh,
they
That
have to
system.
write the okay.
yeah,
Yeah.
Then usually when people forget those hospital books, which is almost all the time,
Uh-huh.
they're kind of screwed because they don't know what happened.
right.
We never understood why this that particular procedure took this long, but it still goes on in Cameroon, which is strange. So we decided, one feature on our platform is we created something called the e-hospital book. So basically, one big thing about Doctors too is we're also creating a master database. That's why it's super secured right now. Everything's encrypted, but we're creating a master database where people can actually access their e-hospital books, their medical records anywhere in the world.
Mm.
Um, and I'll talk a little bit about that. But the e-hospital book essentially is, it has a couple of things. It has the person's lab works, the person's
So
diagnosis, every
results,
result. So
medications.
Basically,
exactly,
all of their history.
everything about their medical history is
Okay.
inside that. So the thing is, when a patient is using Doctors consistently, he's creating that part,
Of
that section,
database
that in
and the
a
history.
database, right? Creating that medical history. This is very important because when a patient gives access to a doctor, that doctor can easily go through that patient's medical
Record.
records, and it will
Mm-hmm.
be easier for that doctor, despite the doctor being in Germany or
Hmm.
whatever, to be able to help that patient still because there's this record. And that was
So
one thing about the e-hospital book. Now the second feature obviously is the video consultation, which that's what makes it a telemedicine project. So again, now doctors and patients can video chat each other, and the video chat model has a lot of features on its own, and I'm actually gonna come back to that because it does have a lot of features. But essentially, doctors, nurses can communicate with their patients. One thing we did too is we discovered that, especially in Cameroon, there's so many nurses out there, and a lot of them are unemployed, and a lot of them are actually can help people with like the basic things,
Right.
and so we wanted to empower these nurses too. So basically, our platform is not only for doctors providing help, like
So it's
nurses
creating relationship between patients and doctors and nurses
and
in
nurses.
between.
Nurses, no, not in between. They can be in between, or they can be solo too on the
Right.
on the platform.
Okay.
Because on the platform, a doctor registers. The doctor has his own dashboard with these different features.
Okay.
Nurses
Right.
too.
Right. Different screen. I see.
Well, I
Yeah.
have a follow up question based on the nurses part.
Yeah.
If are nurses allowed to be solo without a doctor, that is like
And
providing the medication, like
It depends. We feel like it depends, especially in Cameroon. It depends when it comes to there are different kind of nurses, right?
Yeah.
Obviously,
Right.
yeah.
Right.
They're
So, to basically answer your question,
Okay.
no.
no
Nurses get the order from the doctor.
from the doctors.
Right. The patient will come and sees the nurse, and then the doctor goes in and sees the patient. The doctor writes a prescription, or and then the nurse will go and
Go ahead and
deliver. That's what
Yeah.
I basically do, because
So
I'm a medical
every
professional
nurse
myself.
that definitely goes solo on this app will be assigned a doctor.
Yeah, well, so we feel there are nurses, there are bigger nurses, like the nurses that go on to have PhDs.
Okay, so the nurse
Those ones
levels
can
goes, it goes from the RN. RN can become a BSN, and then BSN can become a nurse practitioner.
Exactly.
Okay.
Exactly, and those ones
Still
can
on that.
And
actually
there are
prescribe.
LPNs as well,
Well-
and CMAs. I'm a CMA, so
Okay. Still on that, this app will be very much functional in Africa.
Yes.
Yeah. But in Africa, I don't think they really did, especially in Cameroon. I don't think
Yeah.
they really grade nurses like that, Mr.
Right.
Jampo. So the
Exactly.
way you're carrying it right now,
Absolutely.
you're
Based on the-
expressing it in a, like the app is meant for America alone.
No.
But this app
No,
goes
it's
all the way to Africa,
Africa,
right?
correct.
So if a nurse flies solo on this app in Africa, they might be tempted to make a diagnosis on the app.
so
I'm
here's
asking
the
about
thing.
security measure to that.
Right. So that's why training, right? When you launch the app, you train the nurses and the doctors how to use the app. There's a certain screens and features that applies only to the doctor. There's a certain screen and the features that applies to the nurse, and then the patients. Patients will basically have his or her own chart where he can see the medications, the allergies,
Yeah.
Well, still on that though, I would love for Mr. Patrice to take the question because it's very much. I need the app
So-
creator
Right.
to tell
Yeah.
me if he has any security
So
measures for
so
that.
so so
Yeah.
when it comes to the nurses, right?
Yeah.
The thing about it is, especially initially launching this project in Africa, there's so many things that are uncertain already. Like here in America, there's a lot. The LPNs, the different there's structures. Africa does have structures, but it's a little more lax than here.
Yeah.
So what we're gonna do is we have a whole team, because when anyone registers on the platform. They go through there's like a whole onboarding process that we which we're involved with that.
Yes.
So based on the kind of nurse that is trying to be solo, but the thing is that's just one part of the platform. That might be rare actually, because I'm gonna tell you guys about healthcare facilities, how they can add nurses to their platform, and the nurses still have their dashboards, but they are connected to a healthcare facility. But for a nurse that is trying to go solo, there's more of an onboarding process,
Okay.
and we're not gonna approve any kind of nurse.
Okay,
It has to
so
be
they need
of a
approval.
Right.
bigger-
So basically,
Yeah,
block.
everything-
It has
yeah.
limits. Like
Oh, yeah,
That's
no,
the security
all-
bit I was trying to get to.
Oh yeah,
Right.
There's
no, all
like a
accounts
screening
are
process.
approved.
Right.
Oh, yeah,
So-
when a doctor or nurse registers, they send in their information. Their accounts are still inactive until we determine and approve
Okay.
that their licenses are valid and everything.
So
So-
on this app again, I have another question. Sorry that I've taken so many
No,
questions
go
here.
ahead, go ahead.
All right, on this app, so basically this app gives patients a chance to be in Kenya, for example, in Nairobi,
Yes.
and get and see a doctor in UK.
Yep.
Wow,
Anywhere in the
Okay.
world.
So
That's great.
First of all, I'm proud of you to take this initiative, because if you look at the some of the cause of death in Africa is
Yeah.
medical error. You know,
Exactly.
There's a lot of
patient will
medical
come in,
errors.
Exactly.
maybe he has fever. They
Mhm.
treat it as malaria. It could be anything. Fever is a symptom of anything.
Yeah.
So
Yeah.
this app is really bringing a solution where the patient, they can track, does this patient has a history of certain disease? Is this patient allergic to any medication? So my question is to you is this app going to be stationed in Africa?
So in terms of that question, in terms of that, the it will be primarily for patients in Africa, but the medical
The
expertise
headquarters,
is going.
yeah.
Oh, you mean like the offices, or what are you
Correct.
talking?
Offices.
Oh well.
Oh, you're talking about data, like a database for the app?
Right, because the reason I'm asking you, an African entrepreneur.
Yeah.
So we need to create jobs for our people.
Exactly.
That's my question.
okay,
So
I
is
get
the
it.
headquarter
Oh, don't
going
worry.
back home?
I have. Oh, you guys have not even heard the best part yet.
Okay.
This is gonna actually provide a lot of jobs, and I'm actually gonna get to that. But yeah, it is. We've already started renting office spaces back home.
Oh, nice.
And it's all gonna be, Africans working there.
Perfect.
We also
And
have
that's the initiative, yeah.
the main building back home is also going to have a lot of researchers, because this one thing that we're taking advantage is the fact of in the power of information. Information is so powerful, and that's why we believe if a patient keeps going on our platform, the more the patient is creating that medical history. In the future, when we start using more sophisticated technology like writing AIs for the platform, it will be able to help patients predict certain things based on the information that they've created, the database that they've created on our platform, that database of worth of information. So that's what. But to answer your question, yeah, we're definitely gonna have offices back home. All right. What feature did we're in the video consultation, right?
Yeah, we were in the
Okay.
video consultation tab.
All right, so the next one now is the scheduler. We call this the scheduler. So this does a lot of things. So this is the part where it does appointments. So patients can go on the platform and actually request to see doctors, because doctors on the platform can be filtered based on their profession. Based on their I guess department, medical. Like you can see a heart surgeon on the platform. You can
Right.
filter it to find exactly what you want.
Right.
So when patients go there, they can
So they
actually
can filter based on
filter-
specialty.
Specialty.
They're
yes,
looking for
sorry, that was the
surgeon.
word.
Yeah, okay.
Exactly.
Okay.
So when they do that, so now they can request an appointment, book an appointment
Correct.
to see this doctor. And this doctor actually will get that information, get that request, and the doctor can either approve or decline it. But when the doctor approves it, it just appears on the doctor's calendar, which is one other sophisticated thing we added on the platform. We added a calendar planner for every
Appointment.
And so the patients can click and just make their own appointment
Make their
instead
own.
of calling or walking to the
Right,
clinic.
exactly.
So yeah, a lot of viewers might want to know because privacy is very important, you know. So is there a measure that you're taking to protect patients' privacy in this app?
Yes. So when a patient is booking an appointment, right, that patient's information is not shown. So the patient's first name and last name initial is shown. So, and that's what will enter on the calendar. But there's also one other thing too, is we've actually, in terms of privacy, because privacy and security, when it comes to medical health, we want the patients to be able to control everything regarding that. So we've added a lot of features on the patient's dashboard where they can limit doctors from seeing their medical history if they want for some reason. We also added something called guardian accounts, which I'm going to tell you guys about, because we know in Africa, most of the people that might end up getting really sick are mostly the old in the villages. We have, if like I'm from Com. So if you go to the villages and you go to these little houses, you see a lot of old people who are really sick, and obviously those people cannot really work with technology. They're probably
Right.
they're
Yeah.
not
That's
aware
what
of
I
that.
was going
Yeah.
to say.
So-
Education.
So because of that, then because we were looking at every problem and bringing out a solution. So because of that, now we created something called guardian accounts, where the patient, like the old person's relative, can actually have access, so limited access. So the patient will actually be able to control what access that guardian has, but that guardian is essentially able to book appointments for that patient, and also view that patient's records if
So like a POA, someone who, let's say in the
Or like a
village,
daughter.
you're right, the old people,
Yeah.
uneducated,
Yeah.
that don't know how to use technology, daughter or son can
Yeah.
go in and make an appointment for grandpa,
I
for
think
mom.
that part right there is very much okay, because even if you look at the medical system in the United States, when you look at the HIPAA laws,
Yeah.
yeah,
Yes.
they actually give access to medical records to guardians.
Right,
Guardians.
but
Yep.
the patient has to prove that there's a
Approved.
form
Yeah,
that
there's
from a
there's
medical,
form.
yeah, that
So I think that right there is a good solution for people that live in the small villages, and or maybe older people that don't really have access to much
Right.
technology, but they
Exactly.
really want to access the
Or-
services. Yeah.
Or another thing is, take for example, like I'm here, my grandparents are back home, and if my grandparents obviously cannot, navigate this technology, I can be able to be a guardian, have a guardian account where, because I know they're not doing too well, like my grandma and granddad, they're not doing too well, so I can be able to monitor that through here because of technology. So that's how
Right.
we can. But then we did put, so the patients do have the power, a feature to actually revoke accesses. They can also control what the guardians can see, or they can also revoke that access. So again, we're giving the patient power over that patient's medical history, because if that guardian has access, the guardian can see the medical history as well.
Okay. So is this app going to be functioning intercontinental? So let's say I'm in my village in Congo. I can call my doctor in Cameroon and say, hey, I have headache.
Absolutely.
Yeah.
And
yes.
then
I asked you that,
telehealth.
if you
Yeah.
can get diagnosed
So
from
it's
UK.
right. It's
Yeah.
intercontinental.
So what the only thing that, because we're gonna launch country per country for patients, but medical expertise can come from anywhere. So if we're starting in Cameroon, we'll just limit it in Cameroon. It's location based, because it's such a sophisticated project that we cannot just completely launch in entire Africa. We need to do it like from country
Step to step.
yeah,
Yeah, right.
yeah, step by step.
Yeah,
And we're
it's
also
a
learning.
process,
It's
yeah.
it's a whole process.
Right.
So yeah, that was the part under the scheduler part. The appointments.
Appointments,
which is pretty,
Right.
Yeah.
Right.
Another thing too that the scheduling has is doctors are able to configure their accounts to either accept in-person appointments
Appointments
or only
Like they have
telemedicine.
telehealth here.
Yeah,
Yes.
so the doctor can decide that, he can accept both, and that patient, while booking the appointment, will see, if the doctor configure that in the doctor's account, that patient will see two options, either in person or
telehealth.
Yeah.
Okay.
So if the doctor just configured telehealth, then that it will just be a telemedicine. So we also allowed patients to be able to go see doctors in person as well.
Okay.
So that's why it's like a all-in-one suite kind of software.
On that point, from a medical point of view,
Yeah.
so are pharmacists going to have access to this?
So the pharmacy part yet we haven't we kind of just left that aside for now, because
Okay.
what we have already is way too much.
Right.
So we kind of want to have control over this and kind of figure it out more before we now add the pharmacy part. But that's definitely one of the things we're trying to do
I
down
mean,
the road.
even the pharmacy part, one can argue that it's really not that big of a deal at this point, because when you get your prescriptions ordered by your provider, your doctor, of course, right? You could always just then with them signed, you could go to the pharmacy.
So
and then,
remember, this is
your medication.
e-scribe, right? It's online. It's on the internet, right?
Yeah.
So the reason I ask it because here, when they order the medication on Epic, they have a system called Epic, right?
Yeah.
I
You
know
don't have to
Epic.
take a prescription. You just walk in, you say your name, because they are able to see your information. That's what I was asking in the app.
It's actually a pretty good question, because
Right.
the reason we thought about the pharmacy part later on is because we want that people can also do refills. We want it to be connected to, people can be able to, if they're like refilling their prescriptions, or if they're, if they can, obviously, doctors cannot really prescribe certain things over telemedicine.
Correct.
Yeah,
Correct.
it's not. It's pretty
Unless
much
it's
not
a
allowed.
refill.
Right,
Because sometimes
unless it's
the
a
doctor has to approve it. Like
Exactly.
the pain management medicine, doctor has to approve it.
Yeah.
So, you've answered the question. Yeah.
Yeah. So, but so for pharmacy, there's still a few things that we need to like figure out before we put that. So we just push that aside just for now.
Okay.
Yeah.
All right. Are there any other parts of the app that you want to bring on this episode today, like from within the functionality of the app?
Oh yeah, there's so many. We have a very sophisticated part software in the app that it's called the symptom checker,
Mm-hmm.
because now at this point we have this we believe that sometimes people don't really need to call the doctors, or they can actually, based on this on certain systems. So we have a platform where you click on there. It's called the symptom checker. That's one of the features in the patient's dashboard. So you click on there, then it will ask you a few questions. Then you will ask your age, you ask you what symptoms you're feeling. We actually have a whole human figure that they can actually, if they click on the head, it will show all the symptoms, headache, everything. So they're putting all these symptoms, right? And the system, so we're using a third-party API that takes all that has like a diagnosis for certain symptoms. So what the platform does is you choose all these symptoms, and it now runs, with the help of this third-party API, it will give suggestions of possible diagnosis to your symptoms. So basically, someone can actually put symptoms, and the platform will be like, oh, you're pregnant, or you're malaria, and
because
everything.
this is a great news for Africa, because people die of simple things, like you say,
Simple things.
malaria, typhoid. So if they just download the app and get on the app and be self-diagnosed on the app, and then call their doctors with the symptoms, a lot of lives will be saved.
I want to share you guys just a little story. It's gonna take us off the topic a little bit, but on how important this opportunity is for our people, especially right now.
Yeah.
When I was moving to America back in 2019, right, I was taking glaucoma medications, the eye drops every day.
Right.
Yeah. I went to this hospital in the northwest region of Cameroon, Bingo Hospital, and they diagnosed me of glaucoma. They also did the same for my mom. They said it was hereditary, something like that. So I was taking this medication for almost 6 months, and I moved here. But when I got here, I went and got me a provider here, and then we did the eye test. The gentleman was like, "You don't have glaucoma." That he would bet on his medical degree that I do not have glaucoma. So I was misdiagnosed in Cameroon, and I was taking this medication for 6 months. And he told me straight up that this could cause you blindness if you continue with this eye drop without and he also asked me, he also like tried to help my mom from here. So I did. I called my mom. He spoke to my provider. I mean, she spoke to my provider. Yeah, and then what he also said to my mom was, on his medical degree, he doesn't think my mom has glaucoma. And the truth was, my mom was working with smoke a lot, like smoke. So there was like a lot of smoke getting in her eyes, right? And for me, I was watching the analog TV. Before this plasma TV, I had this little analog TV.
I remember that.
I used to like sit too close to it, and so it was giving me. I don't know what he explained was that TV was used to say, like, I don't know if he said it was UV light, something like that.
Yeah.
So it made me feel like I had sun in my eyes constantly. That's why we went to the hospital. That's why I followed my mom. So on that note, just the fact that I was misdiagnosed and I could have gone blind. And from here, I was able to help my mom. We no longer use those eye drops, and we are all good. We are all perfect. My eyes are perfect right now. My mom is okay too without the eye drops. Just that simple fact that people can get this access to this right now, where you can sit and have a doctor all the way in the UK, in the United States of America.
Yeah.
Check with your own provider back in your country in Africa, and make sure that this tumor that they're about to operate yours cannot be solved with just medication.
And Dire story is actually relevant. You guys have heard of the Doctors Without Borders, right?
Yes.
So we believe that, especially with this platform, a lot of them will be able to help people now. So, and one thing we did for that is we looked at everything, and we're adding more advantages for them. Because if Doctors Without Borders go on the platform and they're actually helping people, this is accumulating the hours. Because we also get doctors to be able to do volunteer hours. So because our platform, the way we're gonna make money is obviously we did like an Uber kind of thing where doctors, they'll charge on the platform. We keep just maybe 20%,
Mm-hmm.
and they keep everything else. But some doctors might want to do volunteer
Yeah.
hours,
A lot of doctors want to do
where
that.
which is free,
Mm-hmm.
and but the thing is, we're giving them an advantage that once they every time they do volunteer hours,
Mm-hmm.
it like loads up on their platform where they can actually download it if they want to, because doctors use that for certain things where they can show that they did volunteer hours here,
Mm-hmm.
and this is especially useful for the doctors without borders. So that's one really great feature we added. Another thing I didn't even tell you guys about is we're also looking at the mini clinics, where that idea where, because we understand that in Africa, obviously this is actually a big problem.
Mm-hmm.
Not everyone, especially in the villages, the rural areas and
Mm-hmm.
everything, will have access to like digital phones, like
Right.
smartphones. They
Yes.
still have
That was
the
another
old.
the old phone. Yeah.
So that was the problem we saw. Then we came out with a solution where we're gonna do mini clinics in certain places, and maybe franchise out the idea
Mm-hmm.
afterwards, but where someone can actually open a mini clinic in their village.
Village.
And what that mini clinic does is it will have a few nurses that provide like first aid kind of things,
Mm-hmm.
and it will also have a room where it's a whole TV on the wall and
Mm-hmm.
chairs, where now people with older people without phones, they can just walk in and have their video calls with doctors
Mm-hmm.
all over the world in that room, which will just be closer to them, so they'll not have to buy um, like smartphones or anything.
That's very good, great
You are solving a very big
initiatives.
problem,
Oh
Mr.
yeah.
Yes,
Patrice.
yes.
You're solving
You're
a very big
saving
problem.
lives. So, another thing, the future that I don't know if you have, Africa is a continent of 54 countries. We all speak different languages.
Yes.
So, do you have other languages besides,
Y-
French? For instance, in Ethiopia, they don't speak neither French or English. So,
Mm.
do you
So
have
so
languages
That's a very good question,
that,
Mr. J.
right?
that was actually the first problem we solved when we started building.
Mm-hmm.
Is we're building it in a way that what we can do is to translate the website into different languages,
Right.
where people
Mm-hmm.
just click on the
The
language
language they
toggle,
speak.
yeah, and just click on it and it translates. So
Mm-hmm.
that's another thing that we're gonna try to find a lot of people that will translate, even Swahili. We'll try to
Right.
get into the dialects. It's gonna be like it's gonna take a while to get everything in, but we already have plans for stuff like that.
That's
That's
great.
Another
This is awesome.
another feature that I thought was pretty impressive
Mm-hmm.
that we did was, so with the video when you're having a video with a doctor or nurse or whatever,
Mm-hmm.
we decided that let's just go all out with this. Let's add things that will make this extremely, like, we want the experience to be that you're doing it digitally, but you feel like you're actually there.
right.
So
Mm-hmm.
take for example, we thought of this. I'm talking with a doctor, and I'm in Cameroon. I'm talking with a doctor in Germany, and I have a wound that's really, really messing me up.
Right. Right.
We're like, what if that doctor wants to see the wound, and maybe he has more idea on,
Mm-hmm.
Mm-hmm.
so we added something on the platform where the doctor can just click on a feature on the video chat, and it's called request an instant image, where the doctor will click that, and it will auto populate with the patient's phone number, and the
Mm-hmm.
doctor sends that. So the patient gets now a secured, unique temporary link on the phone,
Mm-hmm.
where when the patient taps on it, the patient now, it opens up the patient's camera, the patient takes the picture, and real time it just pops up in front of the doctor, already zoomed in, so the doctor now can now look at the wound.
Just like
And
a scan.
yeah,
Right.
right. So now with that feature, doctors now can actually be able to really do help patients in every way. So that was one thing we added on
Great,
the
great, great.
video call.
Wow.
That is
So, when are you anticipating to launch this app?
So we're in the process of testing right now.
Mhm.
Everything is already completely built. My uncle, who is the founder of the project,
Mhm.
he's in Africa right now, but he's going for research, getting office spaces and everything. But he plans to launch it in the next 2 months or so.
Next 2 months.
Okay.
So and just let me take the opportunity to say this. He's gonna be having something called a baby shower for Doctaz.
Oh
That
no,
was his idea
no.
for it.
It's I think there's a word for
That's
that. It's a
good.
business shower.
Yeah, a
Business shower.
Yeah,
There's
a business
that,
shower. That's
yeah,
actually
that's
how it's
something,
called.
that's something a lot of people are doing
A
lately.
business shower. For
Business
him,
shower.
where he
Oh,
has
great.
that he-
Well,
Yeah, what is the process when you download the app? What is the process to sign in?
So-
what do you need? Name, email address.
yeah, just the basic
regular
stuff.
stuff?
Basic
yeah,
stuff,
Yeah, the
okay.
basic stuff. Then once you created an account, then you can now start loading stuff into
Okay.
the account.
Okay.
More medical history.
So
Yeah.
so once you download the app and then it connects you to your doctor.
No.
Or how does that work? Okay, so
I think you get the doctor from the app.
So this
you
is
get
how,
you go to the doctor first and then
Oh yeah, this is something. Oh, this is the part I need to explain now. So okay, the way it works is that so there are several ways you can join the app. So facilities like hospitals can join as a facility. So when you join as a facility, you have a dashboard account where you can add your doctors
Oh,
into your
nice.
facility,
Okay.
and you can add your nurses and you
That's-
can add your
that's smooth.
patients.
it's like
into your-
Epic, but this one
Yeah.
is on the mobile. That's
It's on the mobile
technology.
and the website. The most of the more complex stuff are on the website.
Epic is more
Right.
of like for employees.
Right. No,
Working with
these days
budget.
you can have it on your phone.
Yeah, Epic has a lot.
A lot?
Yeah.
They have so many.
I don't really know
Yeah,
much about
products.
Epic, but I know
Yeah.
that's where all medical.
So you said that the hospitals can join
Yes.
the doctors, and then once their patient goes in, they educate the patients about the doctors. Say, download this app to see your results, to see your what medication you're taking, your appointment.
So
Or
how it
how-
works is so they will join as a facility, right? They'll join, add their doctors, add their patients. Then it starts blank from there. So when the patient now has a interaction with a doctor or anything, chat. So the all that is saved on they start creating their database at that point when they join. So if a patient actually schedules an appointment with a doctor, it shows on the facility's calendar. So every doctor all the schedules, everything on appointments and everything will be on the calendar. So they also have something. We give a lot of advantages with joining as a facility because the facilities can send out push notifications, to both the website and the app for the patients that are joined, linked with that particular facility. Because when a patient joins the platform, the one thing that the patient will be required to do is optional, is to join a facility. So if a patient has a doctor with a particular hospital, right, that patient has to join that hospital so the patient now can access that doctor.
Doctors,
Yeah.
right.
So
that's what I was getting at.
Exactly. So we also give the opportunity for doctors to join as a solo practice. So like a doctor that wants to run something from home, they can join in, and they have their platform too. They can add their patients and still do everything. But they will not have as much advantages as a facility will have, because we do want hospitals to join, but we do also encourage doctors to join.
Okay.
I have a question for you that
solo
might be a
practice.
little bit too big.
Right.
So with this new technology you're introducing in Africa, right? Can a whole country, like the government of any country, just buy this system and use it for all their hospitals?
That's actually what my uncle is trying to do. He's trying to make this project. That's where he's starting with Cameroon. He's trying to make this project one of the requirements for hospitals, because it will be
Really?
Because it will be.
So-
that's why we call it.
I gotta ask.
That's
do
why
you guys need investors? No, seriously. Are you guys looking for investors?
important. This is where it gets spicy.
This
Is when you go
Wait.
to the government and say, make a policy. Every hospital.
Mr. Jampo, we have to get in this right now.
After we
You
have
guys
to-
need investors?
So
There has
obviously,
to
so
be a
huge project,
policy.
of course. No, but the thing is, obviously, when it comes to
Wow.
when it comes to
I want
a
it.
when it comes to a level like that, where obviously we're trying to get it not like composure, but like an optional tool that the government will advise hospitals to adopt it, because
That's what I was saying.
You
Yeah,
know what
make
I'm
a
saying?
policy like, okay, So every hospital, clinics must have
Oh,
doctors.
Well, not must.
no.
Right
That's
away.
how the
That-
government.
that-
That's,
no,
that's how the government should function, anyways. If
Right.
something like this comes to
like
the people,
here, it's a law.
this keeps the work very organized.
Right,
This
and
is
then
a game
it-
changer.
this
They
is
should make it a policy.
this is a big
Well,
technology
that would be
revolution
great.
that will
You know,
solve
if
a
it's a
lot
pro-
of medical errors in
Pitch a
Africa.
game to the government. Do a presentation.
Yeah.
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 After the launch.
Yeah. Oh well. Again, we will probably need a few years to make kind of
Yeah, to get it, like,
get,
yeah,
get
I get it.
all the kinks
Mm-hmm.
figured out. Obviously, box fix and everything.
No.
But yeah, it is. We do feel like this project would really help a lot. I haven't really scratched on all the features, but essentially,
I feel like it's a lot.
We did
So-
do a lot just to make sure we tackled every problem. So one thing to work also think, because we do talk, we do have meetings a lot trying to figure things out. We do have all these features, it's especially as an IT expert, I don't feel like we should release all of them right away.
Right.
So
Some are reserved
we're
just
gonna-
for
right. We're gonna
officials,
safeguard
yeah.
some
Right, yeah.
features and start off slowly,
Slowly.
then slowly introduce the
Upgrade
other
it,
ones
new
as
features.
updates.
Yeah.
But,
So
yeah.
For the viewers who might be viewing us who may have their own clinics, what is the process of joining Doctaz in there? Maybe clinics, or
Yeah.
there might be doctors watching us that might
Right.
have their
It's
private
definitely
clinics.
right.
Absolutely.
Right.
Yeah.
Yeah.
So joining in as we just term it as facility.
Yeah, like
join
a whole
as
facility.
join
Yeah.
in as a facility.
Okay.
So they can join in as a clinic.
Okay.
Obviously, we'll go through a whole onboarding process to check everything. But
Right.
once everything checks out and we approve them, at that particular point, now they will actually be on a subscription plan because of all the features they'll have access to, and because of that, things like the hospital book that we have to go show, all that will be eliminated.
Eliminated.
Everything will now be digital.
Mr. Jean-Paul, this is a very big opportunity for Africa. So what we can also do for Mr. Patrice and his project is, when he launches up, we should go with the camera crew.
Oh, we'll be there.
To,
Oh,
to his
absolutely.
house, and then
Right.
have him show the audience
Right.
step by step how to get everything done.
Everything, okay.
From like an individual signing up to facilities signing up and to patients getting on it.
All the
Especially-
process.
Yes.
Exactly.
Right.
Yeah.
Walk
That will
them
be much
through.
clearer. For them
Right.
to
That's
watch,
true.
to just watch
So
the steps.
yeah, in a nutshell,
Yeah.
walk us through the process of the app, where like you download, you click where to see what, all the tabs.
So yeah, so when you get the app, obviously the app doesn't have as much as you will see on the actual website.
Right.
But we kind of decided to make the app super simple because we do believe that a lot of the people that may end up using it will maybe be old or unable to navigate through certain things. So we just wanted to keep it simple. So when you get the app, you log in, you create an account as a patient, then the first thing you see as a patient is you see doctors and you see nurses. Those two then because we have a tab called experts, so those are the we call them experts. So when you click on doctors, now you see all the doctors on the platform, and you can filter to see those who are online at that particular moment. You can filter based on their specialty. You can filter based on their rating. So one thing we wanted to do that we did actually on the platform, in order to check doctors and nurses to provide perfect work, we created a rating system where patients actually rate their doctors after every visit. It could be in
That's very
person
important.
or
People need to
so.
know, yeah.
And so on the app, when you're looking for a doctor, you actually see the doctor's ratings, and when you tap on that doctor, it opens the doctor's profile where you can see all the what people are saying about the doctor, more detailed information. So with that, we believe that is going to empower doctors to
Absolutely.
put their best work
This-
out there.
All right,
This is
Mr.
a
Patrice,
big
sorry for this, but
revolution.
I think our audience want to know a little bit about you. So
Right, yes.
I'm gonna switch up the questions a little bit to like personal, a little bit,
Oh yeah.
because
yeah.
this app is very much what we need right now,
Yes.
and there is a lot that we need to learn from this app.
Right.
So we're gonna have a whole walk through each show where you're gonna just basically walk
Just
us
show-
through
yeah,
when you
exactly.
launch the app. Because I
Absolutely.
think if you just put in
We
information
could do
out
it
there
too
without
before.
showing
Right.
people exactly what it is,
Yeah.
people are gonna definitely forget. So
Forget.
about downloading
That's
the
true.
app, going through all of that,
Absolutely.
he's better off if he shows us directly how
Absolutely.
to
And
do it.
work through.
Absolutely.
So now
Yeah.
everybody now
Yeah.
knows this app is coming through soon.
Yeah.
It's gonna solve a lot of medical issues in Africa.
Yes.
So
Absolutely.
my first question to you
Yeah.
personally is, what was the drive? What made you wanna create this?
Oh, so actually, this app, this project, this idea was actually again from my uncle, Paulinus Futang. You know, he's one of the most creative business people I've ever worked with. I still work with him now. He has different software projects that I basically work on for him. So when I was still in college, he like. He hit me up that he wanted me to build him a project called Doctaz because he he's my grandparents, his mom and dad, they're back home and he's here and he doesn't really have a way of really checking their history. Like there's not way because the issues that my grandparents had, a lot of it could be helped better here in the a more developed world or something. So because of that, this actually drove him to kind of just come up with an idea where he wants to build something for Africa since there was nothing for Africa at that
Right.
time.
Right.
And the fun when we started Doctaz, Doctaz has changed so much just based on us looking at the different problems in Africa. We actually sit down, do a lot of research, and we find a problem. Then we just think of ways that we can solve it. Rate kind of prioritize the different solutions we have. Then we vote on the best. Then we implement it. So that's how we started. That's how the project was conceived.
That's
So
very
based from
good.
what I'm
So,
gathering, your main drive is the help you want to render to the African population.
Right. So
And the change
okay.
you want to bring.
Oh yeah, I did give the story for my uncle, but my drive for this project is the way I see how this project is gonna help a lot of people in Africa.
will save a lot of
it's
lives.
literally gonna save lives, and I really think that when it comes to someone who creates things, who creates technology, who creates something, they always want to do change, and I believe that this is that one project that is really gonna effect change.
you've
All right.
talked about your
Alright. Excuse me,
uncle.
Mr. JP. I have two more questions, and I will let you go on with your own questions.
Sure,
right? My second
absolutely.
question is- Okay.
Uh-huh.
So my second question is, what are your discipline behaviors that you do every day that you think you might advise the youth on, the really young people out there
Oh, absolutely.
that are inspiring and working hard to one day create what you've created so far?
So, especially for because I've actually had this question a lot. What drives you especially as a developer, or like what motivates you to keep going, or how are you able to, because a lot of people know that developers mostly work on stuff and always face some bugs that can
Obstacles.
obstacles every single time is like part of it. So what's the drive? My thing I always tell people is I made a resolution like 4 years ago that every single day I'm gonna write a piece of code, no matter what it is.
Yeah.
The thing about when it comes to something like this, a lot of things changes. You see libraries in a certain programming language being updated, or things are always changing. And if that kind of programmer who codes once in a while, it's really not gonna work, and you're not really gonna be able to really build what like. Imagine you want to build a project but you really don't know how to, but you feel like you should know how to because
to,
you're
yeah.
a programmer.
Mhm.
But why can't you? So that's why I say what disciplines me is I always try to work on this. If I have so much passion with technology,
Even on
and
your worst day, you still get up and you get on it.
I'll always get on it. I'll make
Great.
sure I stay
Committed to
updated,
it.
in touch with it, and
That's a great
That
discipline
does
to
help.
have,
Yeah.
because when the rainy days hit, because it's always very hard to go do something like that.
yes,
Yeah, and that's why they say it's not about showing up on your best days. It's always about showing up on your worst day.
You're
Right.
That's how you get to where you really want to get to.
Exactly.
absolutely.
Yeah.
Yeah.
Well, my last question for you
Yes.
is directed towards young African entrepreneurs that are creating what you've created,
Yeah.
or still planning. What is the word of advice you can give to them? Because most of them are already discouraged enough that the governments don't really support them, and the system back in Africa don't permit them to really build. You know,
Exactly.
what advice can you give to them as an African entrepreneur?
I would say don't give up, because the one thing, especially with this Doctaz,
Mm-hmm.
we actually almost gave up about 3 times. But the problem is, thank God, I had my uncle. He's
Mm-hmm.
the one person who doesn't give up. I had already given up a few times, but the truth is, based on all this experience,
Yeah.
I've noticed that the one thing, no matter how bad it may seem, if you're starting a project, no matter how low you think you, or if you feel like there's a wall that you cannot
Mm-hmm.
go through, just don't give up. There's literally always a way.
Oh,
And I literally found that out through the course of of all us building this project. We found so many obstacles,
and
and
you
we
guys overcome them, by
always
the way.
overcome. Yeah,
Yeah.
Yeah.
even sometimes it may take longer, but
Yeah.
the fact
One
that
thing
we
is for
just
sure,
stay, yeah,
you're gonna get that done.
it's gonna happen.
Well,
Yeah.
those are all my questions for you today. So, Mr. Jampo, please go ahead and ask your questions.
Thank you.
Yeah, you've talked about your uncle
Yeah,
and the drive of creating the app. What is your background?
my background. So
Educational
yeah,
wise,
so
yeah,
I so
intellectual.
I have I have double degrees. So I have a computer science degree and an
Mm-hmm.
IT degree,
Mm-hmm.
and I I pretty much very passionate. Like, I growing up, I used to live in a room with my uncle. He's still based back home right now,
Mm-hmm.
but he was a developer too. He flew back from Denmark, and he would always work on these projects in the room. And it just fascinated me how he would write a few lines of code and
Mm-hmm.
something happens. I just thought that was the coolest thing. And so he started teaching me HTML, which is pretty much the basics of um, the backbone of every website.
Mm-hmm.
And from that, I started building on it, and I just started, the passion just kept growing and growing. And one thing you hear a lot of developers saying is the best moment is when a developer is trying to figure out an obstacle or bug, and he finally does. It's I usually never stop smiling for hours. It's just I yell, so I'll just jump. And so those feelings, I love that too.
The excitement
The
that comes with it,
excitement
the
when I try,
challenges.
when
You
I
like the adventures.
the
Right.
adventure, when I'm trying to figure something out, and I cannot. Then for some reason I figure something. It's weird because sometimes I'll be in the shower and I figure out a solution. Then I run out and let me go try it, and it works. And I'm like, oh my! So I like that. So certain things like that is what kept me going, and it's what drives me to keep learning and always trying to build and create
Great.
things, a project like this.
So you were exposed to technology from early on, like you
Yes,
said, from your uncle, and that passion developed to this
yes,
day, and you build doctors. I'm
yes.
gonna tell you, Patrice, you are the answer to a lot of problems in Africa.
I don't even
Oh,
think you
This
realize what he has done.
you don't
You
know,
don't
like
realize what you've just done.
you don't know what you've created for the
But
continent.
what
This
you
is an
did
exciting news for the
is
continent,
big.
right? This is what we
I
because
yeah,
we depend on the West on almost
on everything.
everything. So
Exactly.
what you've created, an African child for Africa, it's really something to
It's
be
I think
proud
every
of.
country in Africa should
And
probably consider adopting this system right now.
absolutely, I
Yeah.
strongly recommend
Absolutely.
it. Every
Yeah.
Every
country,
country in Africa.
like I said, it's just promotion,
Mm-hmm.
and
Yeah.
talk to the right people to
Right.
make it at least a policy.
Up-
Right.
You didn't
Exactly.
really answer this question for the audience, and of course for us Africa is home. We
Yeah.
invest in a lot of different things.
Yeah.
So do you guys need investors in this project?
That's the entire reason for the business shower, to
Okay.
expose it in front of
There we go.
investors.
All right, now I
Okay.
see the
Uh,
business. Okay.
But
I
I do want
better
to
get
give credit.
invitation.
Oh my God, guys! I'll personally come deliver the envelopes.
Absolutely, I look forward to it.
I,
This is
I,
a
I
good
am
project
giving
to invest
credit
in.
to. I'm also giving credit to the amazing developers that helped us build this.
Okay.
It was a whole team.
Mhm.
Obviously, it's a very complex project, and we've been at it day night. It's been an interesting.
It's been a journey.
It's interesting experience.
Mhm.
We've gone through probably 6 different whole pages, and we just launched another one yesterday because we're like, this one doesn't look good. Can you start designing a new one? He designs, sends it over, change it, we implement it. So it's just we're
So it's
perfecting,
just now the matter of finishing up and
finishing up. Yep.
it's
So the
Do try to update us
implementing.
though on the launch date.
okay,
When
absolutely.
it's out, do try to update us.
Yeah,
So-
we'll have a show for the launch date,
Yeah.
or like
Yeah,
a week
yeah, absolutely.
prior,
Prior to the
and to
launch date.
inform our viewers,
We
yeah,
definitely
when
need
they
to
can
follow
start
this through.
downloading.
We will follow this through to the end.
Okay.
Yeah,
Oh,
yeah.
yeah. I appreciate
Mr.
that.
JP, do you have any more questions for him before I want to propose a toast on his for Doctaz.
So
Doctor
no,
Monkey.
just our view, nothing really. Our viewers, this is the technology revolution that we need in the continent. A lot of medical errors happen in the continent due to lack of access of information.
Yes.
So this is what we need, and just thank you for what
Thank
you're
you.
doing and what you've done for the continent.
Thank you.
That's
All right,
Thank
ladies
you.
and gentlemen, before I propose the toast today for Mr. Patrice, and of course, the biggest project I've seen so far, Doctaz,
Yeah.
that's basically going to save the entire Africa. Before I propose that, I would like to just inform the general public that if you are a politician, socialist, entrepreneur, trying to grow out there, whatever it is you're doing out there, or an immigrant that has a unique story that you think you need to share with the world and could potentially help someone or educate someone somehow, please don't hesitate to reach out to us on our Facebook page, which is just Africa is Home on Facebook, or on our Instagram, which is Africa is Home on Instagram. Just reach out to us, and we will have a podcast where I will just basically contact you wherever you're in the world via Zoom, and then we can have a discussion, and then we're gonna have you on the show. So thank you guys so much for always watching, and let's propose our toast to Mr. Patrice.
I don't have mine.
You know.
Oh, he's gone. He's gone.
But anyways, Mr. JP is in the toast. This is for you, the Doctaz app.
Good job.
And,
Thank
We're
you.
proud
Thank
of you.
Thank
You're
you.
all luck
Thank
with
you. I
everything.
appreciate it.
Yeah.
And we
Thank
need more
you.
African youths
Like
like
this.
you that are thinking
Right.
of home. So
Yeah.
more
This
success
is
to this.
well researched and approved app. So
Also, can I say one thing? If there are any extremely talented developers out there, reach out to us. We're always hiring. We're creating a huge team back home in Africa.
After the show, we'll have to talk, man. I
Oh,
gotta
yeah.
join this. This is a big
Oh no,
revolution.
for sure. It's
Yeah.
not just me alone. Like, I'm bringing Africa is home to this.
Look,
Yes.
Yeah.
this is
Yes,
a good
absolutely.
initiative.
This
You
is
know,
a-
and we really
Yes, yes.
we believe that since this is this big, we there are also very talented African youths out there, especially in Cameroon or Kenya, Congo. They're right there, and if we can all come together, we can use our skill
that's
sets
what we
and
need.
improve this so it saves us even more and everything.
Gentlemen, let's
Yeah.
finish the toast. This conversation is not over.
All right.
We're gonna keep going.
Cheers. All
Cheers.
right.
What happened to your glass? All right,
Somewhere.
ladies and gentlemen, thank you guys so much for watching. Do subscribe to our YouTube channel and keep tuning in every week for amazing opportunities and education for all of us. Thank you.
Thank you.